I'm Dr. Haley Todsen, a board-certified emergency physician practicing for 20 years, a Menopause Society certified practitioner, and the founder of Optimize Integrative Health.
My name is Bailey. I am the family nurse practitioner here at Optimize Integrative. I have 7 years of experience in the medical field. I am functionally certified, and I love focusing on longevity within this practice, and we hope you enjoy this podcast. All right, now we're getting into part 2 of how we operate differently at OIH. So how do you approach hormone therapy differently than a one-size-fits-all model?
There are patients we have seen in our practice that have tried hormone therapy before and felt worse. And this is why. We individualize treatment, we look at symptoms, history, risk factors, goals, labs, the route, the dose, the timing of the hormone replacement therapy, and follow up and adjust. 2 women can have similar symptoms but need very different plans. Hormone therapy should be monitored and adjusted based on clinical response and safety. Imagine not being handed the same hormone plan as everyone else. Your plan is adjusted to your body, your symptoms, your goals, and your response. You feel monitored, supported, and safe.
What would you say to the woman who says, I tried hormones and felt worse?
I would validate that experience because this does happen. Sometimes the issue is not the hormones are wrong. It may be the dose or the route, the timing, the balance, or the fact that other systems were not addressed first. We need to understand what happened and whether there were other drivers present. That previous strategy may have been incomplete. We take a second look with more nuance and better monitoring.
Why do so many women feel betrayed by their bodies in midlife?
Many women feel betrayed because they're doing what they have always done and it always worked, but now their body is not responding. But it's not the body that's betraying them. It's adapting to the hormone changes, the stress, the sleep disruption, the muscle loss, and the metabolic shifts. When we understand the adaptation, we can run and build a better plan. Picture shifting from frustration to understanding. Instead of fighting your body, you begin working with it. The outcome is more confidence, more control, less body shame.
So what does a sustainable body composition change look like in a longevity practice?
We care about the fat loss, and that's why we follow the STIKU body composition scan. But we also care about preserving or building muscle. Muscle is one of the most important tissues for metabolic health and aging. Sustainable change means improving insulin sensitivity, strength, energy, recovery, sleep, nutrition, and hormones, not just pushing harder or eating less. Imagine less obsession with the scale and more focus on strength, inches, energy, muscle tone, and how your body actually performs. The patient looks healthier, feels stronger, and ages better with metabolic reserve.
Why is muscle such a focus in longevity?
Muscle is deeply connected to insulin sensitivity, strength, balance, bone health, metabolic rate, and independence as we age. So the loss of the muscle is one of the biggest threats to healthy aging. We want patients thinking about strength, protein, resistance training, and recovery. Picture being able to carry groceries, get off the floor, travel, lift your bags with confidence, and staying independent as you age. Muscle is not just about appearance, it's about freedom.
What is metabolic flexibility and why does it matter?
Metabolic flexibility is the body's ability to shift between using glucose and fat for fuel. When someone is metabolically inflexible, that may feel that they are hungry often, they crave sugar, they struggle with belly fat, or feel like they cannot lose weight despite the effort. Imagine going several hours without feeling shaky, irritable, or craving sugar. You'll have steadier energy, fewer cravings, and your body becomes better at accessing stored fuel.
Why is sleep one of the first things you ask about in a longevity consult?
Sleep affects almost every system we're trying to optimize. It affects hormones, appetite, blood sugar, inflammation, cognition, mood, immune function, and recovery. If your sleep is poor, it's very hard to optimize your body composition or hormones. Sleep is not a luxury, it's a biological requirement. Picture waking up rested, not dragging yourself out of bed. Picture fewer cravings, better workouts, better moods that are calmer, and a body that can recover better because your sleep is finally being addressed. You cannot out-supplement poor sleep.
How does stress show up physically in your patients?
So many different ways. Stress can show up as poor sleep, anxiety, digestive symptoms, cravings, inflammation, menstrual changes, even high blood pressure, fatigue, low libido, poor recovery. Many high-achieving patients are used to pushing through these symptoms, but their physiology eventually reflects the load. Imagine your nervous system no longer feeling like there's a constant battle. The goal is not a stress-free life. The goal is a body that can actually handle stress and recover from it.
What outcomes are patients usually looking for when they come to you?
Honestly, they want to feel like themselves again. They want their energy back, their sleep. They want their body to respond again. They want mental clarity. They want their libido back, motivation, strength, and even confidence. They want someone to listen and create a plan that makes sense. The outcome is not just better labs, it's a better function. Picture waking up with energy, getting through work without crashing, feeling present with your family, wanting to move your body, feeling confident in your clothes, and no longer feeling your body is working against you. You actually feel like yourself again.
What does patient success look like in your practice?
Success may look like sleeping through the night for one person, having enough energy and steady energy, losing inches, building muscle, reducing cravings, feeling emotionally stable, improving recovery, or finally just understanding your body. We track objective data, but we also care deeply about how the patient feels and functions. Success may look like putting on jeans that we're finally able to fit again, waking up with mental clarity, having the energy to cook dinner, completing a workout without feeling destroyed, or having yourself say, I feel like myself again.
How do you help patients who feel overwhelmed by where to start?
Here at Optimize Integrative Health, we simplify, we identify the highest impact areas first, and build a stepwise plan. Most people do not need random advice. They need prioritization, accountability, monitoring, and a plan that evolves as they improve. Picture walking out with clarity instead of a giant to-do list. You know your first steps, your priorities, and what you are working toward. The overwhelm turns into direction. Personalized medicine is not about doing more, it's about knowing what matters right now. This podcast and all related content are provided for educational and informational purposes only. Nothing discussed on this show is intended to be, nor should it be interpreted as, medical advice, diagnosis, or treatment. No doctor-patient or provider-patient relationship is created by listening to this podcast, watching this video, or engaging with any of our content. Although I am a licensed physician and Bailey is a licensed nurse practitioner, we are not acting as your personal healthcare providers in this setting. The information presented is general in nature and may not apply to your individual medical situation. You should not rely on anything discussed here as a substitute for professional medical care, diagnosis, or treatment. Always consult your own physician or qualified healthcare provider regarding any medical condition, medication, supplement, or health decision. Never disregard or delay seeking professional medical advice because of something you heard on this podcast. Optimize Integrative Health, its clinicians, and its affiliates expressly disclaim any and all liability for actions taken or not taken based on the information provided in this program.